Welcome to Taiwan Talk. I'm Sheree Felice, and this week I have the privilege of speaking with Dr. Lien-Wen Su, a psychiatrist in Taipei that specializes in addiction, specifically substance abuse. Listen in as he educates me on the possible causes of addiction, specific treatment options, and potential changes he would like to see made to government policy. Welcome, Dr. Su.
Hi, I'm Dr. Su Lien-Wen. I work in Taipei City Hospital. I'm a psychiatrist and specialize in addiction treatment. And also I spend a lot of time dealing with the drug issues in Taiwan.
What got you into addiction treatment?
I was trained in psychiatry. We saw a lot of psychosis patients around the year about 1990. At that time, Taiwan has an epidemic of amphetamine use. So a lot of amphetamine psychosis patients came into our hospital emergency department. They are very difficult to treat, difficult to handle. So I select this topic as my advanced learning about the psychiatric subspecialist. So I get the opportunity to go to the United States, the NIDA, National Institute of Drug Abuse, for a year of training there. At that time, I learned not only the treatment for patients, I learned a lot about the drug issues for the society and how to handle it. It's very difficult. It's a very complex problem. It's not only medical problem. So from that training till now, I almost doing drug-related services, treatment, or program, or legislation, or consulting things related to the drug issues.
When you said that you got into addiction treatment after seeing the amphetamine problem in Taiwan,
yes.
Before that, were you interested in addiction treatment?
No. Before that, in Taiwan, at that time, we do not consider drug problem as a topic for psychiatric training at all. During that time, the drug issues considered as a criminal issue, not a medical issue at all. So gradually, right now it's changing, but at that time, 30 years ago, doctors will not see any patient with addiction problem. They consider this as a crime. It's criminal behavior.
Can you explain amphetamine psychosis?
Yes.
A bit more to me?
Okay. Amphetamine problem right now still is a very active problem right now. Amphetamine will create a lot of problem because of its pharmacological effect will stimulate your central nervous system through the dopamine system. And so it kind of increase your energy and you'll feel better. But the consequences of that is it also causing you to have some psychotic symptoms as well. For example, people were hearing voices, what we call hallucinations or delusions about other people or prosecutors them, other people were going to kill them. Those were the psychotic symptoms. But the patient experiences those psychotic symptoms, they do not know that. So people abusing amphetamine, especially large amount, having this psychotic symptom, your behavior will be very dangerous.
I see, because they can get violent, right?
Very violent, and they don't know about it.
Okay. Do they remember after they come out?
They do remember, but they cannot control the behavior at that time.
What do you think is the biggest addiction problem that Taiwanese people are facing?
We do have drug problem in Taiwan. It's increasing, but it's not a magnitude of very high. Most prevalent is amphetamine right now. And also ketamine. Ketamine is another abusing drugs. And also new psychotic active substance because it newly developed addictive drugs and they mix them together. And we still have some heroin problem. It's decreasing, but still exists. And altogether is that our drug abusing phenomenon is increasing. We try to control it, but never succeed.
How about other types of addictions, like alcohol or betel nut?
Alcohol use or alcohol addiction is a long-lasting problem. Somewhat our society ignore the treatment part of it. We get used to alcohol use. We see a lot of people drink a lot and drunk driving problem, quite prevalent in Taiwan, but we do not consider it as a disease to treat them. We try to control them, but the problem exists for many years now.
As an addiction doctor, do you only see drug addicts, or if someone has a gambling addiction, would they come to you?
Not in my practice, but we consider those as process addiction or situation addiction. Gambling, some people claim that they have addiction on sex or addiction on shopping. They do exist, but it's not related to a specific substance. That's a very huge difference. Because of the drugs, the substance will act to your brain system directly.
When you say drugs, are you including alcohol as well?
Yeah, alcohol. Yeah.
So both, alcohol and drugs.
Alcohol and drug, and also the nicotine, tobacco.
So do you have alcoholics who come see you as well?
Yes.
And people who want to quit smoking can come see you?
Yes. Quit smoking considered to be not a treatment, rather a willingness to improve their health.
Okay,
So,
it's not as serious.
not as serious, but it's a serious problem.
How about Binglang?
Binglang is another it's a betel nuts. It's decreasing a little bit right now, but the addiction is not very severe because chewing the betel nuts, it do not have a lot of withdrawal symptoms, and usually it's a bad habit. It's addictive, and its consequences is quite severe, especially it will hurt your oral cavity. Some people might causing cancer.
I've heard that some people say Binglang is kind of like a plant called cat that's used in Yemen.
Okay, yeah.
They say that Binglang is like a stimulant. So in your opinion, would you say Binglang is closer to coffee or closer to cocaine?
More like coffee, probably. But you mentioned a plant called khat. Khat is the different story. Khat is somewhat like a nature amphetamine, but Binglang do not have those psychotics inducing property.
What do you think is the hardest substance addiction to treat?
I think all are very difficult to treat. I think I would stress on the environment issue because the drug use is a behavior. This behavior is not behavior alone. It's usually related with the environment. And right now in our society environment, those drug users, the environment that causing them or influence them to use drugs still there. If we do not change the environment at all, it's very difficult to control the drug use behavior. Treatment is to help these people to relearn or regain their control power for their own behavior, especially related to the drug. But because addicted to a drug is a disease. Once you're addicted to a drug, the drug already changed your brain chemistry. It's very difficult to ask a person to control himself. They have to have another way to train them to compensate their loss of control. Drug is not the only issue. I think how to not use drug. This is most important. So as a whole, all the addictive substances are very difficult to treat because you have to restore a lot of things to go back to the drug-free environment or drug-free life. I don't know that would be too difficult for everyone to do that, but it's a fact. Addictions are very difficult to treat.
What is the best way, do you think, a government should treat addicts and how they can help solve a drug problem?
Most of people don't understand that addiction is a disease. If people become addicted to a substance, not they choose to addicted to that. It happened. Addiction is a disease. They'll have a long-term problem, so it should be treated. Okay, we don't want people use drugs. That's right, but people already addicted to that should be treated, not punished. Because of the drug scene, the phenomenon of drug use is changing very rapidly. So we should have a very flexible policy to adjust what happened right now. For example, in Taiwan, we used to criminalize drugs, but our jail already overcrowded, so we have to change that. But because we do not have a very flexible policy system to change that, so we suffer the consequences right now. Our jail is overpopulated. So the policy should be changed according to the drug problem right now, what happened right now. But most of the country, very difficult to do that. I don't know what will be in Taiwan in the future, but I think we're in the right way. We right now focus on the provide more service for addicted people. We're still controlling the drug use problem, and we provide the service at the same time. It will make it better balance between the problems.
Do you know any names of groups or any names of the organizations that you say help people?
In central Taiwan, it's at Caotun Liao-Yuan. It's a residential community, and there's a religious organization like Operation Dawn, 晨曦会. They also help a lot of people with the drug problem, addiction problem, but their program is a little bit longer, probably 18 months to stay with it.
What do you think is the best way to heal people with addiction problems?
Okay, this is a very difficult question, but I think there's no perfect solution for the drug issue or the addiction problem. I think among all the countries in the world, no country really solves this problem. So we have to endure this problem for a long, long time. Prevention is important, but very difficult to implement the prevention to an effective way. Treatment will help, but treatment will not reduce the problem a lot. So harm reduction should be very important also. So we have this problem already. We try to prevent it, good. We try to rehabilitate them or treat them. It's good also, but it will not affect right away. So reducing the harm of this drug use problem also very important. If we put all these together, we might have a better balance between drug use and the whole society. I don't think we can control the drug problem totally.
When you say harm reduction, what do you mean by that?
It's a concept about all together. The drug use issue will causing not only the harm of people who use it, also the society dealing with this problem. For example, in Taiwan, we now criminalize drug users, so we put them in jail. And drug user put in jail is a way of trying to solve this problem. But if drug use continue exist, and we put in a lot of people in jail, it's not a good way to do that. That will causing another kind of harm, society harm. We violate their human rights. Somewhat excessive punishment for them. If we put all these together, we can achieve a better balance about the issue. In Taiwan right now, I think we stress too much on the punishment side and not enough treatment.
So someone out there who may be listening to this and they have an addiction problem, what do you suggest they do if they want some help?
You can call the toll-free number I just mentioned before, because that will direct you to the proper services. If you are in emergency status, for example, you are very frightening, suicidal, probably you should go to the emergency unit in the hospital. People in the hospital, they will make a proper assessment of your condition and protect you. For addiction, because this is a long-term problem, changing that will be somewhat difficult. You should seek proper professional treatment and make a plan for that and stick with it. I would like to say that basically we should not do drugs, okay? But if you already doing that, please try to stop. But if you find out you cannot stop it by yourself, you need professional help. Dangerous thing will become more and more dangerous in the future. You should stop it right now. But you cannot do that. Don't try to deal with all by yourself. You need some help. Although in Taiwan we criminalize those, that the reason for doing that is to control this problem. But even so, some people still get addicted to drugs. They need treatment for that. Right now, the government is spending a lot of money trying to increase the services for addicted patients. Not only to control drug problem, also to increase the services for addicted patients. So right now, a lot of hospitals already get into this line of service providers. Don't be afraid to ask help. Call for help. Then you might get it.
Does Taiwan offer AA or NA?
Yeah, we do have an activity of AA. That's for Alcohol Anonymous, but NA is not right now. But several organizations, they try to promote those NA activity to increase those kind of self-help activity for people who need it. We have several NGOs, non-government organizations, they try to help people with drug problem, also some legal issues as well. They will provide some meeting groups, self-help activity, but that it depends on which area you are. So call the 0800-770-885. Call that number. They will give you proper referral because people will understand at your area what kind of activity exists in there.
I hear you're retiring in June.
Retiring, but still working.
You run a drug clinic every...
My clinic time is on Thursday morning.
What type of clinic is it?
It's an open clinic for psychiatric patients and also addiction patients.
So anybody can come?
Yeah, anybody can come. It's a walk-in clinic.
Where do you run the clinic?
The clinic is in Taipei City Hospital, Kunming branch. The address is number 100 Kunming Street, Taipei.
That's it for this week's episode of Taiwan Talk. I'd like to thank Dr. Su again for joining me this week and for helping me understand some of the problems and complexities that go along with substance abuse. Remember, if you're suffering from a substance abuse problem or know someone who is, you're not alone. You can always call 0800-7708-85. That's the free 24-hour drug abuse prevention counseling hotline. You can also use that number if you have any drug-related issues or questions, or just want to find out more about receiving professional services. Remember to take care of yourselves. You're worth it. I'm Sheree Felice.